Okay, so we're going to talk about GI diseases and mouth. So let me kind of go through here. The first part of the chapter talks about the normal anatomy. Okay, so you guys can go over that if you don't know it. Okay, so we're going to start in the mouth. Okay, and we're going to start with talking about plaque. So basically, plaque is the microorganisms and the organic matter that stick to your teeth. So you can look at the anatomy of a tooth, and the tooth is in the bone. It goes in the alveolar bone, right, in these sockets, and the teeth are held in there by periodontal ligaments and cementum. Okay, so the gingival sulcus is like the edge of the tooth. The enamel of the teeth is actually the hardest part in your body. So it's really, really hard, so it should be really tough. But, okay, when we eat sugar, there's actually a bacteria called Streptococcus mutans that ferments the sucrose, okay, and it breaks it down into lactic acid, and the acid is going to eat away at the enamel of the teeth. Okay, it also makes dextran, which is going to kind of create a biofilm and make the bacteria stick to your teeth. There's a bunch of different bacteria in your teeth, or in your mouth. Okay, so there's more than that. This picture is trying to show you how fluoride works. So in your enamel, you have these subunits, and the subunits are like little columns, I guess, kind of like, I don't know how to describe, like maybe like spaghetti or something, and the spaghetti's all packed together. So there's spaces in between these enamel rods, right? And that's where the bacteria and the sugar, the organic matter, can stick. Okay, so then it's hard to get out. So what fluoride does is it fills in those cracks in between the rods. Okay, so now if we look at viral diseases of the oral cavity, the first one we'll talk about is mumps. So mumps is a paramyxovirus. It's transmitted through aerosols. Okay, it lasts about 14 to 21 days. You're infectious for 7 days, and it infects the parotid glands. So those are what actually swell when you have the mumps. We prevent it with measles, mumps, and rubella vaccine. Okay, now we're back to the itises. Okay, so gastritis is stomach. Okay, enteritis is like the whole GI tract, like the small intestines and the large intestines. Gastroenteritis includes everything, and then colitis is large intestine or colon. Okay, so first we're going to talk about, there's two different categories of diseases. So there's intoxications, and then there's infections. Okay, so an infection is when the organism is in there and it's multiplying. An intoxication is when the organism is in there and it's releasing a toxin, and the toxin's what makes you sick. Okay, so if we start with Vibrios. Okay, so Vibrio cholera causes cholera. Okay, so it's a gram-negative, it's comma-shaped, Vibrio-shaped, it's motile, it has flagellum, and it produces an enterotoxin called chlorogen. Okay, so cholera is also known as Asiatic cholera because that's where it started. It's found in cool alkaline water, and then when you add, it's fecal oral. Okay, so when you add feces to it, that's how it gets transmitted. So one of the characteristic symptoms is rice water stools. Okay, so what happens is you have severe nausea, vomiting, stomach pain, right, and watery diarrhea that looks like it has rice in it. And what's actually happening is the lining of the intestines is sloughing off. Okay, the amount of diarrhea is a lot, so 4 to 5 gallons a day. So the big thing is trying to keep them hydrated. So if you look here, okay, these are cholera cots. So that's a cot, and there's a hole for your bottom, and there's a 5-gallon bucket underneath of it. Okay, so and then the IVs, so to keep the fluid going in. antibiotics won't necessarily eliminate it, but it does help. But the idea is to keep them hydrated, and then it'll resolve. It's world. It can be worldwide. Humans are the carriers. So if there's a natural disaster and infrastructure is damaged and the water gets mixed with the sewer, okay, that's when it spreads. So think of places like Haiti or refugee camps in Syria or places that like that where it's hard to get clean water. That's where we're going to have cholera epidemics. Okay, in the U.S., it could be from shellfish that have it that aren't cooked. Okay, now another Vibrio is Vibrio parahemolyticus. Okay, it is found in the bay. It likes salt water. Okay, it's more common in Japan, and it's self-limiting. So basically, you eat bad fish, something that's not cooked all the way, and you get sick, and you feel better in like a week's time. Okay, then the next one is Vibrio vulnificus. Okay, so it's also saltwater loving, warm water. This is from this box is from the Chesapeake Bay Foundation website and how to avoid Vibrio infection. So it can get into wounds. It can also cause diarrhea if you ingest it. It can spread to liver. It can make you septic and cause wounds. Or it gets into wounds, rather. So liver causes septicemia. Okay, can be life-threatening. So here's this little list about making sure that you wash your hands if you have a cut and you're in the bay. Make sure to eat cooked shellfish during warm months. These are definitely in there. They're in the bay. There's a whole bunch of Vibrios in the bay. Okay, now typhoid fever is caused by Salmonella typhi. So symptoms are a fever, malaise, diarrhea. Okay, they get a rash, which they call a rose rash. It can lead to septicemia and shock. Okay, so typhoid fever, like with Typhoid Mary, right? We talked about Typhoid Mary. Okay, so there is a vaccine for this one. So if you're traveling someplace where there is typhoid, they'll have you get vaccinated. So usually it's in developing countries. We don't have it too much in the United States anymore. Poor sanitation, so feces, people can become carriers. Okay, and it can be treated with antibiotics. Okay, now intoxications, this is like food poisoning, or it is food poisoning. So basically the organisms are in there and they're producing toxins, and the toxins are what's making you sick. So Staphylococcus and Staph aureus, those are definitely a big source of food poisoning. Okay, so they make enterotoxins A or D, and that inflames the intestinal lining, inhibits water reabsorption, right? And then it stimulates the emetic center, so you throw up and you have diarrhea. Okay, staph is a lot of times in things that are creamy or starchy. The toxins are heat stable. Okay, so the idea is to keep the bacteria from growing. Okay, now I just have this list. These are 4 other organisms that can cause food poisoning. So Clostridium perfringens, Clostridium botulinum, Bacillus cereus, and then the Pseudomonas cocovenenans. Okay, so these are all cause intoxications. Okay, now dysentery. Okay, so now we're back to an infection. Okay, so dysentery is sometimes known as shigellosis. Okay, so there's usually about 4 species of Shigella that cause problems. Okay, so there's Shigella dysenteriae, Shigella flexnerii, boydii, and then the sonii. Okay, now they're all gram-negative rods. They don't ferment lactose, and they don't move. So they're very similar to E. coli, but just a little bit different. Okay, so they produce this Shiga toxin, and the Shiga toxin is what makes you sick. Okay, so all 4 strands make endotoxin, which is going to give you a fever. It's going to cause the intestine to ulcer and bleed. Okay, and so it's found it can be transmitted from human to human, but apes and monkeys also have it. Okay, so it causes bloody diarrhea with mucus. Okay, 20 bowel movements a day. Okay, so what causes it to spread is poor sanitation or overcrowded conditions. So feces get in the water. Okay, so somehow feces are spreading. Okay, so it happens in the U.S. in daycares when it's warm. So in the summer. So infant diarrhea, fecal oral. Okay, so they say the 5 F's are what spread Shigella. So food, fingers, flies, fleas, and fomites. And it only takes 10 organisms to make you sick, which is scary, right? Doesn't take much. And it can be like hang out on like the toilet. So everything needs to be Lysoled after somebody gets sick with this. Okay, so the treatment is to make sure that they stay hydrated, and they can use Cipro. Okay, now another enteritis is salmonellosis. Okay, so this is different Salmonella species, not Salmonella typhi. Okay, so it's not typhoid fever, it's some other ones. And I have them listed on here. Okay, so it's found in the GI tracts of animals, so like reptiles, chickens, things like that. Usually it self-resolves, but that's why you always try to, like if your kids go to a petting zoo or something, you get them to wash their hands after they're done so they don't pick up salmonella someplace else. Okay, then there's a lot of different E. coli species and strain, or not species, sorry. There's a lot of different E. coli strains. Okay, so some cause traveler's diarrhea. Okay, so traveler's diarrhea can be 2 different things. So one can cause something like dysentery, and the other one can cause something like cholera. And it just depends on what toxins they're producing. Okay, now another strain of E. coli that's always making the news is O157H7. So this one, it first became apparent, I guess, in probably the 90s, and it was Jack in the Box. It was in the beef. Okay, and I think it came up lately in Chipotle. So it's found in the intestines of healthy cattle. Okay, so, and it's just a few cells, but what happens is this E. coli, this strain actually produces the toxin. It's called Shiga toxin, right? The one from Shigella. So, yeah, it's kind of like changed, right? So it produces the toxin that Shigella produces. So it doesn't take many cells to infect. Incubation is 3 to 4 days after you eat it. And the problem, it's really dangerous for kids and the elderly because it can lead to kidney failure. Okay, so it damages the kidneys and then they can die. Okay, now Campylobacter jejuni is another diarrhea thing, and it happens a lot in Washington County because of all the farms that we have, so retail farming. Copious bloody diarrhea, foul smelling, mimics appendicitis. It can be treated with antibiotics. Okay, now peptic ulcer and chronic gastritis. Okay, so the organism that they now know or believe is responsible for ulcers and like chronic stomach problems is Helicobacter pylori. So sometimes they call it H. pylori. It grows really slow. It likes just little bits of oxygen, so you have to put it on enriched media too. It produces urease, so it breaks down urea to ammonia, and it changes the pH of the stomach. So this is a pretty hardcore organism if it could live in stomach acid. So what it does is it causes lesions in the mucous membrane of the bottom of the esophagus, the stomach, and the duodenum, so the first part of the small intestines. To diagnose it, they'll try to do a serological test, a biopsy, which you don't really want to have, and they'll also look to check the levels of urea in your breath. Okay, and I was all into this when I put this in here, but it shows the normal mucosa, and then this is an ulcer. Okay, now this is a repeat. We already talked about this. This is a repeated slide. Okay, now viral diseases. Okay, so we have rotavirus and Norwalk virus. Okay, so both of those cause diarrhea, and they are usually self-resolving. Okay, so hepatitis, so there's a bunch of different kinds of hepatitis, right? So there's A, B, C, D, and E. Okay, so there is no vaccine for C. Okay, but there is one for A and B. Okay, A is fecal oral. B and C are blood or sexually transmitted. D is also blood. And then E is fecal oral. Okay, now B and D usually co-infect. So D doesn't do anything unless you have B. Okay, so you guys know hepatitis infects the liver, right? So it can cause jaundice. It can lead to liver cancer. So I have a chart in the Moodle notes, and I have information on the study guide for you guys to look at. Okay, there are also protozoan diseases, and there's worms. There's a ton of stuff. If you look at the book more carefully, it has a lot of different GI diseases. We're only hitting some of them. Okay, so there's amoebic dysentery. So an amoeba, the amoebas get, you get it from drinking the water, or from drinking the water or eating food that's got it in there. So it'll cause diarrhea. Imagine that. Okay, it can be treated with Flagyl. Okay, and there's Giardia. So Giardia is also treated with Flagyl.